Thank you very much. Good afternoon, everyone. Welcome to our 18th Coronavirus Town Hall. I recognize that for most of you, we've been sheltering in place for quite many weeks, and I know that it has put a lot of strains on you personally, perhaps professionally, perhaps your job, your business. There's a lot of stresses and strains out there, and I'm very sensitive to how difficult that it has been for everyone. We know that as we try to curtail this great public health threat, that it has required these extraordinary actions by all our parts. The good news is that we have started to flatten that curve. We're saving a lot of lives and protecting our healthcare system and all that we are doing, but I know that it has been hard for everyone. Today we will be discussing something that could decide how safely we really do emerge from the shelter-in-place orders that have been in effect since March. One of the crucial elements of lifting those orders is the ability to test people for the virus, and then when someone tests positive, notify people that person might have exposed to the infection. And once someone has been notified, they can be tested and self-isolate if necessary. Most of the countries that have contained the virus have used a very aggressive program of testing and tracing. Today I have for guests who can help us learn a lot more about the way contact tracing has been done in the past and some new ideas that would use technology to reach more people more quickly. And so let me run through our guests and the conversation that we're going to have in this very quick hour. We're going to begin with a conversation with Ben Christopher, a journalist who's written extensively on this issue. We're going to then go to Dr. George Rutherford, UCSF expert in this area of tracking and tracing, to hear about the traditional efforts that have gone on and will go on going forward. We're then going to talk to Tina White, who works with a group called COVID Watch, who is developing a new application to be able to warn people if they have been exposed to the COVID-19 virus. And then we're going to talk to Jacob Snow from the ACLU, because these apps can raise a lot of issues of privacy that we want to raise and have a discussion about. So let me begin by introducing with a little more extensively each of our speakers. Ben Christopher. Ben covers California politics and elections for Cal Matters. It's a nonprofit news site focused on California public policy and politics. Prior to his work at Cal Matters, he's reported on the economy and the budget for a variety of publications here in the Bay Area and around the state. And as I understand it, Ben, you got your master's in public policy from UC Berkeley. Go Bears. Is that right?
Go Bears. Yes, indeed. Thanks for having me.
Well, thank you for being on, Ben. Dr. George Rutherford is a professor at UCSF School of Medicine, and he leads a team training thousands of Californians to trace the contacts of people who tested positive for COVID-19. His path to medicine took many twists and turns. As I look at your bio, Dr. Rutherford, you earned degrees in classics and chemistry and history at Stanford before going to medical school at Duke. Well, that's an interesting track to be on. His research interests have focused on epidemiology and the prevention of infectious and tropical diseases of public health importance, both internationally and domestically, with a primary focus on HIV and AIDS. And you are also a professor of epidemiology and biostatistics, right, and director of the Prevention and Public Health Group. Dr. Rutherford, thank you so much for being in our conversation today.
Thanks very much.
Next, Tina White. Tina, you are an aerospace engineer turned applied machine learning researcher, and that's a lot of twists and turns there, too. You earned your master's degree in aerospace engineering. You invented and patented a method for eliminating flutter in turbo machinery at Honeywell. Congratulations on that. For your dissertation, I'm told you designed several artificial intelligence networks that can break problems into parts while learning to make aerodynamic predictions from very few examples. You've got your doctorate in mechanical engineering, but I'm told in late January you were inspired to create a mobile app to warn people about COVID-19 while also protecting their privacy. You now lead COVID Watch, a group of volunteer scientists who are creating an app that promises to alert people who have been in close contact with someone who later reports that they tested positive for the virus. We look forward to hearing about your app. And I understand that your program would allow it to be voluntary and anonymous. Ms. White, thank you very much for being in our conversation today.
That's correct. Thank you so much for inviting me. Looking forward to it.
Very good. And Jake Snow, the Technology and Civil Liberties Attorney at the ACLU of Northern California, where you work on a variety of issues, including consumer privacy, government surveillance, algorithmic fairness, and the preservation of free speech online. Jacob, you work in courts and the legislature to expand digital protections and ensure that existing rules are robustly enforced. Before joining the ACLU of Northern California, you were a staff attorney in the San Francisco office of the Federal Trade Commission, and you served as a law clerk to Judge Ronald White in the Northern District of California, and you got your law degree from Georgetown Law. Jake, welcome to our conversation.
Thanks so much, Senator. It's great to be here.
Great. And we're going to begin with Ben Christopher. Let me note that we've asked people that they're welcome to send in questions for our guests. I've gotten a few dozen of them already. And as we continue this conversation, if something stimulates your interest and a question, please send them in, and we're going to do our best to answer them. Ben Christopher, let's begin. You've written on this subject. You've written about the tensions between public health and privacy. Give us a lay of the land. What's at stake? Where are we today in these issues?
Sure thing. So just to set the terms a little bit, when we talk about contact tracing, this is, I guess sort of what it sounds like is as soon as a public health authority learns that someone has been infected with coronavirus, they reach out to that person, try to create a list of their contacts, all the people who they may have come into contact with and potentially swapped germs with, and then reaching out to those people to let them know that they may have been infected, that they should get tested, that they should stay isolated, and trying to cobble together sort of a network of possible transmission. And the hope is to nip any new outbreak in the bud. So contact tracing is not a new idea that has been developed in response to COVID-19. It's been applied to all kinds of infectious diseases. And it's not something that necessarily works if you have a full-fledged pandemic, because there's no way to sort of play catch-up. But if you get the number of cases down to a manageable level, which is what the state and every county in California is now trying to do, the idea is that if you have enough contact tracers, you can keep the spread of the virus in check without having to impose lockdown on all of society. So it's sort of a more surgical approach. The analogy that I often hear is that your contact tracers are sort of like the initial attack squad in a firefight. So the people who go in and put out the brush fire before it rages out of control. But as I just described it, it's clear that it's sort of by definition it can be a very privacy invasive procedure. You're getting someone to recount every contact they've had in the last week or 2 weeks or 3 weeks, who they've been in touch with, where, when, and so obviously that raises some privacy concerns.
And Governor Newsom clearly has identified this as an important part of the staging and the recovery elements for our state. This is not, and I know we're going to talk to Dr. Rutherford in a moment about the specifics of what he's doing, but do you feel like the state and the counties are directing the resources or have the resources to do this type of traditional track and trace that you speak of?
So they don't have the resources yet, but as you know, it's a really important component of the state's reopening process. So for example, the governor has a series of benchmarks that counties have to meet in order to receive approval to begin moving on to the next more lax phase of the stay-at-home order, sort of allowing openings of restaurants and shopping malls and schools and that kind of thing. And so under the current rules, the county has to have 15 tracers ready to go for every 100,000 people living in the county. And so I don't believe there are not very many counties who have that yet, but it's something that the state is working on. I believe the last time I checked, the state has trained nearly 3,000 contact tracers, and I believe the projected need is something like 12 to 20,000. So we're still catching up, but it's something that the state has put a lot of emphasis and a lot of resources into.
So we're going to talk in a few minutes about new technology that I know you are aware of to kind of change that traditional old school model. What in your reporting, what are you hearing from folks in a 10,000-foot level about their willingness to embrace? Certainly Governor Newsom talks a lot about the innovation that makes California special and our willingness to embrace new technology. Any reports at the highest level of our state and beyond as to is there a warm embrace in this direction that we're going to hear about in a few minutes?
Well, I think maybe there's a tentative embrace. I mean, there's certainly hope that an app or some kind of technological assistance can play a role in this. And just to explain why, the limitation with the manual contact tracing approach, obviously it's very labor intensive. You have to hire thousands of people and train them to do this work. But the other limitation relates to the virus itself, which is just inherently pretty difficult to contain in this way. And that's because someone with COVID-19, the incubation period is anywhere from a couple days to a couple of weeks, and that's if they're symptomatic at all. And so you might have someone who is shedding virus left and right for weeks before they think to get themselves tested, at which point they've already been this sort of massive network of people who they may have come into contact with who have to be tracked down. And so just the nature of this particular virus has opened this conversation that perhaps there are ways that technology, the smartphones that most of us are carrying around in our pockets, might be able to help with this, if not replacing the old method, at least complementing it.
Very good. So that sets the stage, Dr. Rutherford. The work that you're doing to train track and tracers for all around the state seems like a daunting task. But let's start at the beginning. Talk to us through the basics of contract tracing and how it works.
Sure, my pleasure. And first of all, let me say, Senator, that you represent UCSF among other places, and we have a UCSF Benioff Children's Hospital, Oakland, has a large outpatient presence in Walnut Creek in your district. So thank you very much for that.
You're very welcome.
Contact tracing started in 1937 and was first described by the U.S. Surgeon General then and in a book called Shadow Upon the Land with great melodrama. And it was about syphilis contact tracing, which is one of the most kind of commonly used reasons for doing contact tracing for this. And it was all a matter of sort of troop preparedness, frankly, and whole battalions being sort of undergunned because people were out with syphilis. It was used it's been used extensively for sexually transmitted disease control. We also use it for tuberculosis control and occasionally for investigations involving things like outbreaks of measles and other childhood vaccine preventable diseases. But we were UC San Francisco and the San Francisco Department of Public Health have a very tight historical relationship. And I was asked by the director of public health if we could have, if UCSF could put a team together to help the city with its contact tracing efforts. They have contact tracers who are doing mostly syphilis and HIV and tuberculosis contact tracing. But we're being overwhelmed by the number of cases as they were coming in. So we put together a group of about 40 people from the Institute for Global Health Sciences who usually work in Malawi working on HIV. Who were unable to get there and all trained in public health and all raring to go. We trained them and got them into place, and then the city started to repurpose workers who were being paid but couldn't work. So we have a large presence from the city attorney's office in San Francisco, from the assessor's office, and my favorite are the city librarians. And we taught them how to be contact tracers, and we've augmented them with some volunteers, including some of our medical students and nursing students and some retired physicians from UCSF.
I know that there's a lot of skepticism about our ability to track and trace with such a large state. But can you get to the area of, so how does it work? You have a workforce that you've been able to build, at least in San Francisco at the moment. Although I know you're trying to do something statewide. But tell us tell people listening exactly the process you go through.
So Senator, say for instance that you were diagnosed with COVID, your name would be reported to your county of residence. Someone from who we call a case investigator would call you and go through a detailed history of where you may have been infected, whether you're sick or not, whether you're able to isolate yourself, whether you need to be in the hospital, all those kinds of things. And as part of that interview, they'd ask with whom you've been in contact when you're likely infectious. You become infectious, that is, you can become contagious, you can transmit the disease as early as 48 hours before you develop symptoms. So you would say, yeah, there's these 3 people that live in my house, and we live in the same house, and I met these people at work, and, we talked through kind of what exactly the contact consisted of. Were you within 5 feet of them or 6 feet of them for 10 minutes or more? Did you have a mask on? Did you not have a mask on? So you really want to drill down and understand the context. Those names and that locating information are then given to the librarians and other people, the contact tracers, who call them or get in touch with them, confirm that they've been exposed, and then are referred for testing. If they test positive, then they become cases and have to go into isolation. If they test negative, they need to go into quarantine. And then there's a back end to all of this that supports people who are in isolation and quarantine. So that's the kind of mechanics of it.
That's the mechanics. Now, how many people do you typically contact when you're trying to trace someone's exposure to others?
Right now, in shelter-in-place, the median is 3.5 contacts per case.
And if we weren't not in shelter-in-place, for some other illness where there was no shelter-in-place, such an extraordinary thing that we're in, right? What would be the typical contact number that you would have to reach out to?
So leaving aside syphilis, for tuberculosis, we probably do maybe 10 people, something like that. It's going to go up somewhat, but not tons.
So it's 3.5 today with shelter-in-place. It has been up to 10. So there's a range now. And how do you find people who a person might have exposed without knowing it? Like they say they ate in a restaurant. What do you do to really find everybody they might have touched?
So they're really only coming into contact with people sitting at their table and maybe the waiter. We can, if we get sufficient information, we could call the restaurant, find out, understand maybe from the credit card slips, or that we haven't done this yet, but as we theorize about it, understand from the credit card slips whom the waiter may have been, the wait person, and then add that person to the list. But you have to be in pretty close contact for a pretty prolonged period of time and not have a mask on in order to make the cut for being tested. Now, once you make the cut for being tested, you buy yourself quarantine if you're negative.
Right. Now, I've seen some graphics and stories that have been written of restaurant diagrams where they showed how many tables and who on each table got infected. It wasn't someone like a waiter standing there taking your order. It seemed that with this virus, at least it's been asserted in some case examples, that it travels much further than one has been that you have described, vis-a-vis a waiter, a restaurant customer giving an order.
Sure. So I'm talking about restaurants once they've taken half the tables out. And so I'm talking about kind of the future state of restaurants.
Got it.
Yes,
okay.
In the old days when you were standing 5 at the bar, there were probably a fair amount of transmission that went on. But now with this sort of the pared down versions of what restaurants will look like, and what they did look like for a few days before the state went to shelter in place for about a week, it really did cut down transmission. Plus, people are going to be wearing masks. Now, I realize you can't wear a mask when you eat and drink, but you can wear them coming in, and you can keep them on when you're not eating and drinking, and that helps a lot.
So we're going to go to Tina White to talk about some of the new school way of potentially tracking people through apps. Have you thought about using Bluetooth to track contacts and notify people in terms of your work?
Oh, hi. So,
hold on, Tina. Let me just go back to Dr. Rutherford. Have you ever employed it, or are you considering any use of that type of application, Dr. Rutherford?
We think about it. We are piloting it's not really an application. We're piloting a technique to query people's phones with their permission that they may have been over the last handful of days. if they need to jog their memory. But it's kind of a memory aid, and it's done in front of the person and with their permission.
And finally, before I go to Ms. White, these questions could be a little intrusive. I've already gotten some questions from listeners who've raised real worries about the information that they're providing on an app or otherwise. How do you get people to want to cooperate with you on these types of delicate questions?
Well, people have been quite forthcoming. I think the Mayor Breed has helped a lot in San Francisco by talking a lot about contact tracing and civic responsibility and, the social contract and things like that. Plus, people don't want to have their, grandparents die and their parents get sick. So it's, this is not a trivial illness, and it's, you're sort of playing for keeps here. And I think people get that, especially the people who've gotten sick. They understand how sick they really are. So
very good.
We seem to get a fair amount of cooperation.
So let's bring in Tina White. Ms. White, what made you decide to create an app to warn people who might have been exposed?
A couple different things. I started seeing the news out of China at the end of January, and was concerned about it coming here. Was not in control there, and also at the same time, China released an app that was a very surveillance-friendly app, I guess is the way that I'll put it, where they're requiring people to use it. You get arrested if you don't tell the truth. And there have been similar apps developed in East Asia, different kinds, using either GPS to track where people are and who they've had contact with, or using Bluetooth to figure out who is interacting with who in a way that I was very worried about coming here. So the concern of our group is about digital privacy and rights, and how best to design systems that aren't. Is there any way to design a system that actually keeps that information private or doesn't collect any identifying information in the first place, but still might be able to help? So we started our effort looking into doing research into ways to make these systems more private and more civil rights respecting. Because we expect that many people, especially in Western countries, would not download an app like that voluntarily. And anyone who's planning to build something like this, in any country that's looking into it, is in the West anyway, is looking into building voluntary systems. So you have to design something that people would actually want to use, that they don't feel is surveilling them and that isn't surveilling them. So we looked into ways to possibly do this information where you're communicating to the people who have been exposed that they have been exposed, but doing so in a way that doesn't actually need to collect any identifying information about anyone. So we found a way to do that using Bluetooth technology. So you could also use Bluetooth technology and just collect identifying information too. But there is a way to still send the alert without collecting any information about your name, your phone number, nothing. You could still design it's a little bit of a technically we're calling it a decentralized system and an anonymous system for doing these Bluetooth-based alerts. So if somebody tests positive, they can send alerts to the people they've interacted with, but nobody, that information isn't sent to a government or anyone nobody can interpret the information that's sent, except for the phones that you've interacted with, who would record logs of these random numbers or words and use those to figure out and how to route messages to the correct people. So we come up with a system that is fully anonymous, and we're very excited about it. So there's now a way to alert people that they've been exposed without having to expose them to any risks that are associated with collecting identifying information about people. For example, if a database is hacked and somebody gets that information who was not the original person you wanted to, you might really trust the public health authority, but if somebody's able to hack into that database, you get lots of information, identifying information about people that you don't. We want to protect people's digital rights in our group. So this is what we've designed, is a system that there is no database that has anything, information about people that anybody would want or be able to get access to. So it's all stored locally on the phone, and that way you're just sending alerts to your contacts instead of creating a central database that would possibly be used for surveillance. So we were excited about that. We started working on it. We're a team out of Stanford and Waterloo. And once we developed this technology, many other universities and groups became very interested in it, and it inspired DP3T in Europe and PACT at MIT, and also the Google Apple protocols enabled this kind of anonymous system as well. So we went ahead and built an app based on this technology too. So we started a separate nonprofit to rapidly develop this app that uses only these anonymous messages. And we're now trying to advocate for them to be used. And we're a little bit concerned because some states and countries are still in the process of developing these apps that are based on identifying information. And like Utah's app, for example, collects identifying Bluetooth information and GPS. And there are other apps that are planning to collect GPS. Google and Apple have banned the use of GPS now in the Bluetooth-based system. So, we're excited to move forward, and we're trying very hard to advocate for the anonymous methods. Why build something that enables surveillance when you don't have to, and you can build an anonymous version instead? So we've been advocating that for the past couple months and have built an app based around that system.
So let me put my common guy summary. So what your app would do is, if it's on my phone, and in the course of my day, my phone is through Bluetooth can communicate with other phone devices that are in the area, and if someone who my phone has pinged in the course of my day has been identified as someone who has gotten COVID-19, that information would be communicated to me through my phone, and I would get a notice that it wouldn't tell me who or necessarily where, but it would say that I had been in contact and therefore I should take precautions. Is that, in summary, what would happen if your app was on my phone and on others?
Yes, that's correct. So anybody else who also has the phone, you'd be alerted if later they came down with the virus, and only if you've interacted with them to a significant extent. And everybody who's working on these apps is still doing research. So at what level, or at what the way that we're estimating how close two phones are together is with Bluetooth signal strength. So I can give sort of a 2-minute explanation for how the anonymous system works, if that would help.
I think the shorthand version would be great.
Yeah, okay. So what would happen is, if you have two apps that are near each other and that both have the app installed, so anybody who installs the app, what will happen is it will use Bluetooth, which is a shortwave radio signal, which means that you can only hear it over short distances. So it's just like sound. And what Bluetooth is doing is it's sort of yelling in Bluetooth a number or a random number. You can think of it as a random word is a little simpler. We use numbers, but either way it's random. So you draw a random word out of a hat, and it says, let's say they're all food words, it says potato. And so each of the phones is every few minutes drawing out a random word and just yells it once in a while. So every few minutes yells potato. And then another phone, if it's nearby, can hear that it's yelling that in Bluetooth. And if you hear that sound, then you know that there's a phone nearby you, and that means it's probably a person nearby you. And if you hear it a few times, that means you've been interacting with that person for a significant amount of time. And then what the phone will do is it'll record the word that it was hearing. So it heard the word potato, so it just writes that down in a log that's locally on the phone. I heard potato. And then this word changes all the time. So after 15 minutes, you're going to draw another word. And that one says peanut butter. And so now your phone is yelling the word peanut butter. And so it's always changing, and therefore it's not associated with identity. So it's kind of like, in the end, on the phone is just something like a grocery list, like potato, peanut butter, and all of these are just random words that have been drawn out. So later, if somebody is test positive, now what they can do is they'll report on their phone that I was positive, and this has to be verified by a health agency somehow, so either a lab or any other public health authority that can say that this person is positive. We'll give them a permission number, so then you report it in your app. So if you report in your app that you're positive, that list of words that you've been sending out, I sent out potato, peanut butter, tomato, apple, and that goes up and is downloaded by all other phones, what those words were. And if anyone interacted with you in the past and remembers, oh, I heard the word peanut butter a few days ago, and that was and you'll write down the time that you heard the word, so that only the people who've interacted with you during your possibly infectious period would be alerted.
Okay.
And so if they see, I said, I saw peanut butter, that means I was significantly exposed, and then you receive an alert on your app. And so this is how an anonymous system works. If you have an identifying system, instead of yelling out random words, you yell out a number that is actually identifying and connected to your identity somehow. And so
I have some follow-ups on that, but let me ask you, does your system, as you envision it, require a certain number of phones to actually have downloaded that app to have it really be effective? Any conclusions on that point?
So there's a difference between how many does it take to be effective for people to download it, and how many people need to download it for it to alone stop the virus. So there's a team out of Oxford who did a really good analysis on this, and we trust their results. And what they were saying was that in order to stop the virus, 56% of people would need to download this on their phone. And that means about, including that there are kids, and there are a lot of people who don't have phones, so it's about 80% or 75% of smartphone users would need to have an app like this if you wanted to have this alone stop the virus without other interventions.
Okay.
So that number can be lower if, in addition, you have proven methods like manual contact tracing too on top of that. So this is really designed as a way to help. So even at lower numbers, you still get with alerted additional contacts that might not be alerted by a manual contact tracing. Because all of these systems have failure modes to some extent. With manual contact tracing, you might forget the person you interacted with, or you just didn't know the names of the people that were near you at the restaurant. And so it's harder to track them down, or takes longer. So instead, you just get this anonymous alert, and a few people might be caught and alerted early that would have not been alerted otherwise. So even at small
I got it. So there's a range of apps that are on phones vis-a-vis effectiveness, and it's meant not to replace what Dr. Rutherford's doing in the traditional track and trace, but to supplement it in some fashion. I have some follow-ups, but before we go there, I want to identify another perspective about this, and then bring in Jacob Snow from the ACLU. Then, Christopher, in your reporting and others, you talk about some of the tension between these wonderful technology folks creating new ways and public health folks who worry that while the privacy protections that Tina White's talking about in terms of her app may be of some value, that central control, meaning that the state, the government, the country wants to know who has the virus and where they are, so they can make sure that someone is tracked and traced and quarantined if necessary. And so there are some of the reporting out there is that the public health community isn't very excited about apps that Tina White is speaking about, because they're going to lose control over who has it because of that protection of privacy. Is that what you're seeing and hearing?
Yes, I've heard that pushback as well. First, I just want to commend Tina White for the explanation, because as a journalist, I've tried to explain how this technology works, and I'm not sure if I did it quite as effectively as she just did. So that was great. But yes, I have heard that pushback. It's been in the headlines quite a bit in the last 24 hours, because as some of the people who are listening to this might have seen, Apple and Google just released this technology, which they're now calling an exposure notification tool, which isn't an app, but it's sort of the underlying system, very similar to what Tina White described, that public health officials are now being invited to use to build their own app. And so, again, it uses Bluetooth. It's anonymized. It's decentralized. But there has been that kind of pushback from some quarters, not so much from privacy advocates, but as you said, Senator, from public health officials who say that this is the very thing that makes the system privacy protecting, makes it potentially less effective, in the sense that, by design, the system does not collect a list of names and contacts and all the people that a COVID-positive person has been in proximity to, and public health authorities say, well, it would actually be great to have that information to reach out to those people directly in case they don't check their phone, or they ignore notifications, or they don't get tested. So I suppose it is one way in which, at least potentially, the interests of public health and the interests of privacy might be coming into conflict.
So let me summarize then where we are. So Apple and Google today released the platform that Tina would take her app and would be able to weave it within. And that if you have a public agency that sees this as an outcome that they want to support, that they would then fund or adopt TINA's technology in the hopes that it would contribute to suppressing the spread of the virus. Is that a fair summary?
Yeah, my understanding is that the Apple and Google protocol is very similar to what Tina White just described. But that, if a state wants to adopt something like this, they would be limited, or if a county or any kind of public health government organization wants to adopt this, they would be limited in the sense that they wouldn't be able to collect more personal information using this technology, yeah.
And because Apple and Google have said they're not going to allow their platform to be used by some state force to track people, that privacy is so critical to from their point of view that they're not going to allow their platform to be utilized in that fashion. Is that right?
Yeah, that's right. And I mean, it's worth pointing out that the old-fashioned way, if you like, of contact tracing is quite invasive by design. And so in some ways, this debate is not just about what kind of information is collected, but who is doing the collecting, who the public is willing to entrust this kind of data with. The idea of passing along to a public health agency people might be more comfortable with that than the idea of a large Silicon Valley corporation having anything to do with that
having all that
like
information, whether it's a big company or government. Jacob Snow, you've been a leader on this issue of privacy for the ACLU. I'm sure you're tracking this debate, the different views. Bring yourself into this conversation in whatever place you think most appropriate about your happiness. You're sheltering in place too. You're exposed to the virus like we all are. You want it to be put in its place and gone forever. What's your take on the old-fashioned, the new-fashioned? Where are you on this issue?
Yeah, thanks. So first of all, I think it's worth taking a little bit of a step back and thinking about why some people might be disinclined to share their private information with the government or with a private company. And the reason I think it's important to start there is that distrust is not something that necessarily has had to exist. Governments could have acted differently in the past, and private companies could have acted differently in the past. And if they had acted differently, we might not have the crisis of trust when it comes to privacy and surveillance that I think is motivating a lot of the concern around people thinking about whether they want to install an app like that. Governments have used, in fact, have used recently license plate databases to track down immigrants. They've put dragnet surveillance into electronic systems like email or cell phones. And private companies have seen a drumbeat of data breaches and privacy violations. And so when we are all looking at the public health response that is absolutely necessary, and all of us are in our homes right now and thinking about getting back to work and seeing our family and friends, I think it's important to reflect on how past actions have caused some of the privacy and surveillance concerns that are really posing barriers to a public health response. With respect to the solutions that are out there, the anonymized solutions that Tina White has described and that are in the Apple and Google solution that's been proposed do a pretty good job of protecting people who have not been infected from having their information disclosed. There's a lot you can do to technically audit those, and the ACLU has released a white paper on what technology-assisted contact tracing should include as a technical matter, but they do a pretty good job. But there are, as Tina mentioned, proposals that would go a lot farther and actually collect people's location information. And for those proposals, and in fact for all proposals, it's worth really thinking about whether the information that's being collected is going to be effective at responding to the public health crisis. Governments should evaluate and set real benchmarks for the efficacy of their technologies that are used in this crisis, and think about accuracy, the risk of false positives and false negatives, and known limitations. And then one other thing that I think is important here is equity. Governments really should proactively develop projections and plans to target deployment of resources to communities that lack the technology and other support needed to use a contact tracing app. And use of aggregate data with appropriate privacy protections could help there. But we live in a world where 30% of people who make less than $30,000 a year don't have a cell phone. 50% of people who are elderly don't have a cell phone. And so for those populations, an app won't do them much good. And so that should be a real focus of the public health response, is making sure that we don't deploy solutions that only protect people who are doing well and not people who are struggling.
All good points, Jacob. Thank you for raising them. Well, we've gotten a number of comments, and I'm not sure this goes in a different view than those who are a part of this conversation. Leo writes in and says, I have a huge concern for an app that I just heard about called Healthy Together. If someone installs it, it automatically sweeps all of your contacts and everyone on your social media platform, and then there's a method for tracers to contact everyone. I am vehemently against this intrusion. I don't think, Tina, that's the correct description of what you're talking about with your app. Isn't that right?
Oh, no, I'm 100% in agreement with this writer. So Healthy Together, I think, is referring to the Utah app. So what we were most concerned about was an app like Singapore's app coming here. Singapore's app collects identifying Bluetooth data, and I think that was sort of one of our strongest concerns because it's a still new form of surveillance and it was unnecessary.
And you don't sweep
Utah
in
went and did
contact.
something even worse than that with Healthy Together. So they have centralized Bluetooth, they have GPS, they have a lot of other personal information collected, and they combine it all into one app. And we were very shocked when we first saw that release. I think this is the one built by a company called 20. And I think that's kind of that's the thing that we're here to stop from happening.
Okay.
Because it's unnecessary to collect that information to send. You could do it anonymously, then why do it that way?
But Tina, you say your app that you're developing, does it identify location or no? Just that there was a person who had been identified as infected.
No, we will never collect location data in our app.
So you don't collect
we don't collect
location
identifying. Yeah, that's right.
Okay.
So location data, actually, GPS trajectories are highly identifying. Everybody's path through space is very unique. So you can't collect GPS data and say that your system is anonymous. So we're only proposing anonymous systems like this, like the Bluetooth-based decentralized anonymous system that I described, where you're only collecting those random words. And that's all that's ever collected is that grocery list of words and the time.
All right.
Nothing else. And it's very important that there's nothing else that's collected.
Got it. Some more.
Can I jump in there? This is Ben Christopher.
Oh, sure. Of course, Ben.
Yeah, so just to sort of paint a picture for why that sort of location data might be sensitive. So I wanted to sort of describe what's been kind of an extreme example, which is in South Korea, which has been famously effective at fighting this virus. Public health authorities have been using smartphone location data and then also merging it with other information like CCTV footage and credit card transactions to develop this really comprehensive view of interactions that a newly infected person may have had, and then using that information to sort of blast out warnings to everyone with a smartphone in a particular area, saying something like, hey, a 23-year-old woman in your neighborhood went to this bar on this night and then went, to a hotel with a companion, and you were nearby, so you should get tested. And, of course, there's, one of the consequences of this is that people have been going on social, social media detectives have been going on saying, oh, a 23-year-old woman who works at this bar, well, we know who that is. And then it becomes very easy to sort of identify people with just a few bits of information like that.
That's Ben Christopher, journalist at Cal Matters. Jacob, I've gotten a couple notes in that are probably music to your ears. Chris writes in that says, I will never allow the app on my phone. There's too much opportunity for abuse, violation of privacy, etc., regardless of how data is collected. So with all due respect, I'll pass. Joanne writes in and says, I strongly oppose these methods. This proposes extreme issue and concerns on privacy, civil rights, and civil liberties. These surveillance proposals listed on your email are direct violation and complete infringement on individual rights. I guess, Jacob, you must hear this a lot.
I do hear it a lot, I think that those comments are reflective of the fact of the crisis of trust that I already talked about. There's a Pew Research study indicating that 6 in 10 Americans are skeptical that tracked locations through their cell phone would make much of a difference. And I think that's because, with some justification, people look at the information that's collected about them from their cell phones, from their activities online, and they see it as being collected and used in ways that don't benefit them. And so the skepticism about new systems of information collection really comes from bad experience with experiences in the past, in all candor, both from governments and from private companies.
Very good. Dr. Rutherford.
Yeah, can I,
oh, please go ahead. Tina White from
Can I respond to these two? Because
of course.
Yeah, so mostly I agree with the people who have written in as well, and this is why our whole effort got started. Because you could either say this shouldn't, let's not build a system like this at all to help alert people to their exposure because there's too much of a risk. Or you could build an alternative technology, so like fighting the surveillance technology with good technology that does it the right way, and in a way that is transparent. So you don't trust the system or to trust anybody who's running an app like this for it to work, because of the fact that if you are open source, then you can see exactly what people who are doing it are doing. So it's out there for everyone to see how the code works, what it actually collects. And then if it's a nonprofit, then they're not motivated to be selling your data to somebody else. It's not working that way. So our nonprofit has the mission of developing alternative technology to emerging technologies that may be starting up as something like because of the response to COVID-19 that might not be considering other values like digital rights and privacy, and to try to combat that with better technology that has been designed with those rights in mind. So our team started 3 months ago building this alternative technology to have, once these apps showed up that were surveillance apps, to have the alternative in place and say, instead, you could do it this way that doesn't collect that data, and we're open source, and we're nonprofit, and you can go and do it in the right way in this direction, or you could do it in a way that, wasn't designed with privacy rights in mind, and, to be ready in time by the time that the more surveillance-friendly apps got here, to have an alternative that, the public health department would choose to use this instead, and this is what we have. So,
very good.
So that's kind of how we fit into that space.
Got it. Dr. Rutherford, let me bring you back into the conversation. A person writes in and asks about the phone number that you call when you're tracking somebody. Is it an identified phone number as a public health number? A lot of people aren't picking up phones these days if they don't know where the call is coming from. How are you handling that? What do people see when your trackers and tracers try to reach them?
It comes up as a jumble of numbers. It's not anybody's particular phone number. It's not identifiable it's a local number, but it's not. It doesn't track back, say, to a hospital or to a health department. It seems to be working pretty well.
All right, and
I agree. People don't pick up their phones a lot. So.
Yeah,
they do pick up their emails and they do pick up text.
So there is a lot of skepticism that, given the infection rate in the state, that the army that has to be built is enormous. And how can we really have confidence that the old style of phoning, tracking, and tracing each contact without technology can really be effective? What do you say to the skeptics that wonder, how many folks do you have to hire? And by the way, there are a number of people who have written who say, where can I get a job? And who can I contact if I'm interested in being a tracking and tracer? If you could address both of those, I'd appreciate it.
Well, the first thing is that all these people have jobs, and they're being retasked. So they're public employees who are doing other things, who have real jobs, or that they were hired for, and they've been repurposed for this. So there's no workforce being hired for this per se.
Is
So
that
these
in,
are all
that's in
people
that's in San Francisco? But are you
no,
training?
that's statewide, sir. That's statewide, sir.
I see. So that what Governor Newsom talks about the training, he's not talking about hiring new people or
Correct.
volunteers. He's talking about taking, say, if the DMV is closed, they're taking DMV employees and training them in tracking and tracing through your training program.
Yes, sir. Exactly.
All right. I have heard that some of the counties are hiring directly, but you're not familiar with that?
I am not. I know Santa Clara County is asking for volunteers now, but there was a press conference today about that. So, but right now we're using repurposed state and county employees. I trained people yesterday, and had people from Placer, Monterey, Sonoma, and Fresno counties who were being retrained as contact tracers.
All right. So you're optimistic then. You feel like you have a workforce that's going to be large enough to do this type of tracking and training, given thousands of new cases every day where you have to reach out to many people to try to figure out who they've been in contact with?
Correct. I mean, and they're about 1,000. Well, we could get into inadequate. I think right now, as things stand, because you're only doing it for today and yesterday and maybe the day before. If it's longer than that, it's too late, right? You got to catch people within about 3 to 4 days of their exposure, or else they're going to be transmitting it to other people. So that's what we want to, that's what we're going to focus on, are the more recent cases. If I may, there are a couple of other things that I think that are somewhat worrisome about applications. One is that you don't know necessarily where the contact works. If somebody's working at 4 nursing homes, that's the sort of thing I would like to know pretty quickly in a contact tracing program who's been exposed and may be infectious. It's the sort of person you want to get tested first and really have a good understanding of. The other thing is the whole idea of these alerts being triggered and the question of false positives. If you're named as a contact, as a close contact of someone, and you test negative, so there are consequences to getting this wrong.
Dr. Rutherford, I think your reception kind of went out again. You said,
I beg your pardon. I'm sorry. I said there are consequences of getting this wrong and having people falsely labeled as close contacts where they're more casual contacts. And the reason is that they have to go into quarantine for 14 days if they test negative. So you want to be pretty careful about whom you call a close contact. Make sure there's really a biological risk of transmission.
Well, Nick writes in and he asks the question, what level of risk is created by a 5 to 10-second conversation from 6 feet away with a gardener where neither party is wearing a mask? So there you go. 5 to 10-second conversation, 6 feet away, neither party has a mask. What kind of risk?
0.
Okay. Not too worried about that.
Yeah, I'm not too worried about that.
Okay. And finally, we've been in quarantine. I mean, we've been in shelter in place for 50+ days in the Bay Area. Yet, we see a little drop in infection rates, and obviously some of that's because our testing is going up, certainly around the state, with tens of thousands more people being tested. But you do ask a number of questions in your tracking and tracing that you're doing. So why is it that our hospitalization rates have stayed pretty steady? Statewide, they've been over 4,400 for the last 4 to 5 weeks, even though we're in shelter in place. Wouldn't your tracking and tracing be able to determine who are those people? They're not all from nursing homes. Are they frontline healthcare workers? No. So what does your data show that you've been collecting as to who is it that's still being infected out there?
They're mostly people in large multi-generational family houses, two or three families living in relatively smaller dwellings, and it gets passed from person to person to person to person to person. Also, in San Francisco, where I know the best, whom we're seeing, there are people who really are out there basically are day laborers or essential workers. So it's not so much in the medical settings because there's a lot of PPE being used. It's more people in other kinds of settings where they have to get out and about, where they have to ride public transportation, all those kinds of things. So there's a kind of constant background of transmission. Don't think we can get rid of all transmission, What we want to be able to do is catch and stop large outbreaks. That's really kind of a first tier priority.
So where there are countries around the world that have seemed to have done a good job of tracking and tracing, an element has been quarantine, and in some cases, taking someone even out of their household to ensure that they don't infect others. If you're finding that the spread in California now is more likely than not coming from a larger family in a small space, why are we not advancing efforts to pull people out of that difficult circumstance, have them be cared for separately from the larger family unit so that the spread doesn't continue?
Well, in fact, at least in San Francisco, we do. The city's rented a number of hotel rooms specifically for this purpose, or if people have no place to go, like the homeless, who can be isolated, that is, they're infectious, or be quarantined, that is, that they're exposed, away from the rest of the population. Now, it's an expensive solution. For the first SARS in 2002, 2003, the Chinese government erected massive tents where they kept people in quarantine. We haven't come to that yet, but it's a concern, and that's something we ask ourselves every morning, whether there's can these people really safely isolate, especially by isolate, I mean they are themselves infectious. Do we need to get them out of their living situation and put them somewhere where they aren't going to infect other people? In fact, we do it from time to time. That's
Dr. Rutherford from UCSF, who is leading the tracking and tracing program for San Francisco and for California. Tina White from COVID Watch, let me bring you back in a question from Maryland. She says, will we have to download all of the various apps for this to work? Or will they talk to each other so I only have to use one? What would you say to Maryland?
So it seems like there will only be one app that for each state or for each country that uses an anonymous alert system. If there were multiple apps and they didn't talk to each other, then it wouldn't function as well. So Apple and Google have gated the use of these apps so that only one state, within a state, only one can be used at a time. And that's just like a necessary part of like getting the technology to work properly, because if there are multiple apps using different systems, then they wouldn't be able to talk to each other, and so you'd miss the connections between people who might be using different apps, which would be bad. So the way to avoid that is they've limited it to one per state. So there should only be one within whatever region you're in. Okay,
that's Tina White from COVID Watch. Tina, another question from Gary. He says, what will be the plan to promote, educate, and incentivize broad usage of the app? What are your plans going forward?
So this is the big challenge ahead. I think it's a challenge that to some extent always fails, which is the science communication behind it, because this is a novel technology. This was invented in our group, and we've been thinking for a long time about how best to communicate how it works in a way that people can just easily understand. So we've been trying very hard to think of ways to describe it well, to describe the anonymity, like it's not anonymized because there's no data that's collected that needs to be anonymized. It's already using information that is just these random words, and that's all that's ever collected. So there's like ways to phrase it and to talk about it that are more clear about how it works. I think for any of these apps to be effective, there needs to be a lot of communication to the public about how they work, because it's new and it's not like any other kind of messaging system that existed before. And Bluetooth is this kind of at this special intersection that just happens to apply really well to this problem, but there was no need for it before. And also, in order to build a system like this, it requires no changes to existing laws and regulations. It could have existed before. It's just there was no need for it or no demand for it.
If California wanted to say, hey, you've sold me, when can we get this going? How fast are you from finishing the product and having it available for use in California?
In California, so we have an app that's ready. You can download it on. You have to have a link from us from Test Flight, because which is like just a place where we can test out the app. because until a state signs on, you can't actually provide it in the App Store because of what I described before, because there can only be one app like this per region, and that makes sense. Yeah.
So Martha
I'm
writes
sorry,
in,
was there more to your question?
well, no, Martha kind of follows up. She says this non-invasive open source app sounds great, but what can the average listener do, if anything, to support this effort? So you were describing that you're doing a test of it that they can access. And again, how do you access it?
So we have a website. It's www.covid-, the symbol dash, so covid-watch.org. One way you could help is to donate to us. Another way is if you have connections in California, to encourage them to use an app like this and not to use one that's centralized. There are multiple apps now that are trying to build decentralized versions. Ours is the farthest along that could provide it the soonest. We could probably, I guess the earliest timeline would be sometime like end of June, but that's because it requires cooperation with health agencies. So our technology on our side is done, but we need some amount of like piloting, making sure it works with health authorities, and because within the state there can only be one. So you need to work with a health agency to get the permission system working so that people can't falsely self-report, and that takes time to do. So probably at least a few weeks.
And I'm going to give Darlena the last question here. She asked a couple of different questions. She says, is there a cost to this? And if so, who's going to pay for it? And then she asks, when this app tracking ends, can you take it off your phone? What happens to the app after the pandemic is over? Tina White, what would you say to Darlena?
So originally this app was, something like this app was being developed for helping with the regular flu. We ran into another team that was building it to so you could share with your friends if you have gotten the regular flu and perform a protective bubble around your community. And then they realized when COVID-19 started that they could build this for that, and that would be even more effective than for the regular flu that doesn't have such a long infectious period. Before you're symptomatic. So it's something that that we don't need to change any existing laws and regulations to use. Like small communities could continue to use it if they wanted to. And the data is only stored in your phone. So if you delete the app, then it's just no longer there either. And if you delete the app and you call us and say, "Oh, I deleted it. Can you get the data back?" We can't because it only ever was on your phone. So it's a very private system. It's very easy to delete the data. It's only that list of random numbers anyway, but if for some reason you want to get rid of it, you just delete it and then they're gone because it's stored locally.
Well, Tina White, thank you for your creative skills that you've applied in such an important way. It stimulates a lot of great thoughts about how it can be deployed here in California and across the nation and around the world to help us with this terrible pandemic. So thank you for your good work. Any closing comments from you?
Thank you.
Appreciate the conversation. Jacob Snow.
Yeah, I
go ahead,
do appreciate
Tina.
the conversation. Thank you. No additional comments except to just say thank you for inviting me on so I could talk about this.
Well, we appreciate hearing all the work that you're doing. Jacob Snow, again, this is not a new place, privacy for you and your organization, the ACLU. Any closing comments?
No, it's been a great discussion. I appreciate the comments of all the other panelists, and I learned a lot, and thanks again.
Very good. And Dr. Rutherford from UCSF, you have a big job on your hands. You have my appreciation and praise, and I know a lot of hard work ahead to be able to build a workforce that can take old school but effective, work to try to isolate the problem, right, and to shut it down. Any final thoughts?
If your phone rings, answer it, please. Thank you.
That's such a good answer. And Ben Christopher,
wash your hands and wear a mask.
Oh, that's right. Wash your hands and wear a mask and stay. Physical distancing is very important. Absolutely. Ben Christopher, you've written some of the best stories on the subject area. A lot of research, a lot of hard work. You've informed me, and I know you've informed our listeners here in the Bay Area and elsewhere. Any closing thoughts from you?
No, nothing for me. Hard to beat Dr. Rutherford's plea to just get everyone to wash their hands. But thanks so much for having me on. Really appreciate it.
Appreciate it. Well, listen, folks, for those who've hung in there to listen to this conversation, I hope you've learned, I certainly have, about the old school technology that's being used, and some of the new technology that is yet to be put in place in California, but has a lot of the state leaders looking very closely to see how it can be used effectively in a way that protects our privacy, which we know is important to all of us. I would note that there is a recording of this conversation that will be on our website later today, so if you want to go back and listen to something, you can go back and listen again. That's sd07.senate.ca.gov. At that website, we have a whole host of valuable resources on this whole COVID-19 situation, whether it has to do with loans for small business, unemployment, dealing with pets. We've done a lot to try to bring the smartest information from the Center for Disease Control, your county health department, available to you with a couple clicks that can help you out. And at that website, this is our 18th town hall. We've gotten 17 that are stored there about mental health, about the grocery supply chain, a whole host of subjects that hopefully have enriched and informed our listeners about what we are going through, and it has not been easy. Next week, to preview our 19th, we're going to talk about future of restaurants. Under the staging that the governor has implemented, we're entering stage 2 here in the Bay Area region, and after certain benchmarks are met, we may be in a position to have dining in at restaurants again. But what are the limitations, and what are restaurant owners doing to try to survive going forward under those limitations? We're going to bring in some of our great restaurateurs from the Bay Area to talk about the future and how they're going to try to figure out how to adjust so we can enjoy their wonderful dining in our future. I want to say again as we close that I know how difficult this has been for many personally, jobs, businesses, being able to pay the rent. This is such a difficult time, and we're working very hard to try to figure out ways to make it easier, to allow us to endure as we get through this. But as we've talked about before, we all have to work together. The curve is bending because we are all respecting the need to shelter in place, to only go out for essentials, to keep the physical distancing, to wash our hands, to wear a mask. All these things are what are going to allow us to get through this as soon as we can. I'm holding these town halls to try to bring you accurate, reliable, up-to-the-minute information. I'm so appreciative of our guests today to talk about the old and new technology to help us do that, and we hope to have more of these town halls in the weeks ahead, as I've mentioned to you. So thank you all very much, and I wish you a wonderful day.